you get sick because you get old, or do you get old because you get sick?
The clock strikes 60 and then you get diseases. That's not the case. So you are getting older every day. But the way you get old is in your hands. If you are a person who has been eating bad, who's been sleeping bad for years, this is, as we call it, deficit and accumulation. So it accumulates over years and then it presents as a disease. So diabetes on the face value is just a single word when you put diabetes mellitus, but it affects multiple organs as in long term. It affects your eyes, it affects your nerves, it affects your kidney. Then avoiding health checkups. I mean, just from the fear of discovering something is not the right thing to do. See, it's all about correcting the correctables till they are correctable. If you don't check, then all these things can get worse.
Hello there. Who can give you the best advice to age healthy? Obviously, a senior who is healthy, right? But you know what? There are also experts who can do the same thing, and these experts or expert doctors are called geriatricians. A geriatrician is essentially a specialist doctor who treats seniors and helps them to live healthier for longer. And let's go straight across to our guest today, who is a geriatrician. We are joined by Dr. Prem Narasimhan, who set up the geriatric clinic at Mumbai's Jaslok Hospital. He is also the founding team member of the Wisdom Club, which is a premium elder care services company. Dr. Prem, welcome to the Longevity Short. Great to have you here.
Yeah, thanks, thanks. It's great to be here.
In fact, I must begin by saying, and this is a very ageist comment to start this podcast with, but I do need to tell you that, you look terribly young for someone who specialized in senior care. So how did you, actually end up doing this?
Yeah, I mean, it is a funny question purely because it would not be asked to a pediatrician because he's not a kid taking care of a child. But yeah, I've got these questions before as well. I would say, I mean, geriatrics chose me. I was always close to my grandparents, but most people are. It's not that they aren't. But I slowly and steadily sort of gravitated towards it. And when I started, it was a nascent sort of specialty in India, but it's picked up. So geriatrics chose me. I wouldn't say it was that I specifically knew a lot about it when I took it up. And I mean, here we are. So yeah.
But, first, there's this question that's always been bothering me. Uh, so tell me this, do you get sick because you get old, or do you get old because you get sick? So which comes first?
So it's like the chicken and egg sort of question. I can say that when you get older, the risk of getting sick becomes more because, see, ultimately we are a well oiled machinery, but even a Mercedes needs servicing. So the parts obviously get older. So one has to understand. And secondly, it's the environment. So you are not living in a silos. You are actually interacting with the environment. So an older adult response to an environment will be much different as compared to a younger person. Whereas if you have sickness when you are younger and that actually percolates when you get older, that becomes even more difficult. So you might have diseases of young and you get older, so that will be more of a challenge.
Okay. So the other thing you mentioned, environment. What influences us more as we age, or how we age? Is it genes or our habits and the environment?
So I would say both. There is something inside, which is us, and there is something which is outside. So it's a balance, but the environment, the way we interact, depends upon our body's sort of capability. So that comes from the intrinsic capacity, which we can say, or the ability. There is something known as homeostasis. So that's the balance. The ability for the body to fight back obviously becomes more difficult. So it's a mixture of both. I mean, from within and outside. That's how we might. And disease is completely different. We are not talking about disease yet. We are only talking about the aging body and the environment. And the disease actually complicates things.
Okay. But then there are seniors who, who stay healthy for a very, very long time. So, of course, you meet a lot of seniors in your practice. Now, what is common to people who age healthy and people who, end up falling sick?
So I would say aging healthy is because they have done something good or right in lifestyle, keeping away from diseases. It's not that they're, I mean, hiding somewhere. They have been actually having a good lifestyle whether it's the amount of stress they have, whether they are sleeping well. Whereas those who are sick might have pre-morbid conditions. By that, I mean maybe they are born with a very strong family history of diabetes, heart disease. So there is an inherent risk of that happening, along with habits which were formed much earlier. I mean, nobody gets the clock strikes 60 and then you get diseases. That's not the case. You're working towards getting old when you are 9 months old, 1 month old, 60, 70, 80, all. So you are getting older every day. But the way you get old is in your hands. So you have to make sure. So, whereas if sickness takes over earlier, then that control goes a lot. So you have to control the diseases along with controlling your aging. So they get interlinked.
I have one more question here. We often hear of a lot of people telling us that, oh, I know so and so who's done everything wrong in that, health wise. They don't exercise, they smoke, or they consume a lot of alcohol, they eat whatever they please, and they're still healthy. So, uh, how would you explain something like that?
So I think there is a perception of them being healthy, that I agree. But we have to see what is the bigger picture here. There is a difference between only healthy and being healthy and happy. Now, that particular person might actually be very happy in life. The person sleeps well, the person actually has a good social environment. Now, the only thing which will catch up, which people don't realize, is as you get older, the organs start giving away. So, what people have to understand, what was good for you when you were 30 is not going to be good for you when you're 80. And it's same with drugs. Just because you are on some drugs for 20 years doesn't mean that it's applicable now also. So,
Hmm.
that drug review has to keep happening. So, the thing we need to understand as we get older is that adapt. I mean, adapting is natural. I mean, you are 80 years old because you have adapted to life. So you have to adapt to circumstances and evolve. And when you evolve to newer circumstances, then you live longer. And a lot of people have a very negative connotation to aging themselves. So it comes from within first, I feel. If they are convinced that they are actually going to be better, then it works very well.
So,
Just
so
don't
what
go
you're
on the
telling us
fact
is,
of,
if you are positive about aging, if you look at it as a good thing rather
yeah,
than a bad thing, something rather than that you're going to decline,
yeah,
the
yeah. And
chances
another
will.
thing, as you said, just because people have some bad habits, well, maybe one or two people are aging well like that.
Hmm.
The majority don't. So, because illness does catch up with people who, I would say, if you have to bluntly put it, if you continue to abuse with a very, I mean, God given nice body, then it gives in someday.
Right. And you mentioned diseases, and this is what I want to ask you. What about, can diseases actually speed up how you age?
Absolutely. I mean, ultimately, if you're diagnosed, for example, with a heart disease and you get a heart attack at a very young age, obviously the chances of you getting a heart attack much more as you get older will increase. You get a stroke earlier, it will increase. If you have had, for example, multiple injuries in your, for example, knee or joints, as that aging happens, the chances of osteoarthritis obviously increases. Then habits always matter. I'm coming back to that because they're all correctables. If you are a person who has been eating bad, who's been sleeping bad for years, this is, as we call it, deficit and accumulation. So it accumulates over years and then it presents as a disease. So if you're already diseased, you are already on a weaker kid. But again, control of the disease matters. You cannot say just because you have hypertension and diabetes, you will definitely be having a bad aging. If you are controlled it well, you will still be in a better space as compared to a person who is absolutely not taking care of his diseases and expects them to age themselves properly.
Right. In fact, to our viewers, all these diseases that Dr. Prem just mentioned, they all are come under this umbrella called non-communicable diseases, which means these are not infectious diseases, like say malaria, for instance. So, non-communicable diseases are those like diabetes, heart disease, hypertension, etc. Now, these in fact are responsible for 63% of all deaths in India, which is why we cannot afford to take them lightly. In fact, it does seem like, and like from whatever Dr. Prem has told us up until now, it does seem that we are responsible for how we age, and we have a huge responsibility in determining how we will age. So, Dr. Prem, let's do this. First, let's talk about these diseases that essentially speed up aging. Then we can understand what are these habits that you mentioned that are actually aging us. And of course, we are not going to let you go without you giving us a plan of action at the end, uh, as to what are the things that we should be doing to get our aging right. So make sure you watch till the end, and let's get started with Doctor over here. Dr. Prem, how do these NCDs or non-communicable diseases impact health? What have you seen in your practice?
So, I mean, even if you have to highlight, it's diabetes, hypertension, myocardial infarction, which is the coronary artery disease, then stroke, even to an extent, hypothyroidism, which is very easily missed in older adults because a lot of times, if you don't have thyroid before, you tend to not check it later, which is a wrong sort of notion. So, again, these are all accumulated illnesses. Now, if I have to pick up diabetes, so diabetes on the face value is just a single word when you put diabetes mellitus, but it affects multiple organs as in long term. It affects your eyes, it affects your nerves, it affects your kidney. So the more control you keep on the diabetes, the lesser is the end organ damage. So you're potentially avoiding blindness, kidney failure, and nerve degeneration and nerve failure. Now add to it into the mix a dementia, a depression, a risk of fall, urinary incontinence. So these are all typically geriatric syndromes. Unfortunately, no older adult will come with one disease. A lot of time, multiple morbidity is very common. Diabetes, hypertension, heart disease, those NCDs plus a dementia, plus a fall, which made them bedridden. So they got bed sore. They lost control on your urine, on their urine. So it becomes very complex. Now, what we always say is if you control the diseases, now curing and control is different. If you ask me if you're able to completely cure, it's difficult to say purely because it depends on the life history of the disease. I mean, whether it's been for 20 years, 30 years, 40 years, and how you have controlled it. If you have kept it in steady control, people live long with all the NCDs. I mean, it's not that they don't. But it's not only drugs. That's what I am trying to. A lot of older adults and general population thinks that once you start drugs, everything will be fine. No, that's not the case. Your lifestyle matters the most. I think the amount of water you drink, the food you have, you know that a high amount of oil might not be good for you. Fried is not good for you, but you still continue to take that. How much of painkillers you have? I mean, drugs abuse is very, very common because in India you have over the counter almost everything available. Certain drugs, of course, have come under the purview and it's only on prescriptions, which is good. So painkillers are chronically taken. Then avoiding health checkups. I mean, just from the fear of discovering something is not the right thing to do. Memory screening is never done. I mean, even health checkups don't provide that. How many times have we seen a hospital saying that you do your memory screening? So that is also very
In
important.
fact, in fact, let me
Uh,
interrupt you here. One of the things that like for instance, like you yourself said, geriatrics itself is in its nascent state, so though it's slowly picking up now. Most people don't ever go to a geriatrician. So, one, do we need? Does everyone need to go to a geriatrician? Second, when should we be going to a geriatrician, and what are the tests that we should essentially be doing? Like you mentioned, memory screening.
Yeah, so I think ideally everybody 60 plus should be going to a geriatrician purely because it's like having a one-stop person who will take care of everything and will refer you to other specialties if needed. That is number one. Number two is geriatricians always give a lot of time. Older adults need time. It's a life course history. It's not only a disease which we are talking about. Health is a state of physical, mental, and social well-being, and these three pillars are very strong in older adults. So if they're physically and mentally okay, they might not have social connections. So when they come to me, I'll also try to establish social connections because I know support groups. I know a lot of organizations which do good work in socially connecting people. So all the three factions matter a lot. Now, as far as we as geriatricians add to other specialties, like for example, orthopedics is very common where post surgery, pre surgery, we are involved. Then for ophthalmology, uh, then To take care of an older adult, if I say that I can do it alone, it's not right. I cannot. The multidisciplinary team is always needed. So, if needed, a physiotherapist, a dietitian, three things which are very important for me, which I think our viewers should keep in mind is you have to get an eye checkup every year. You should know whether you can see. You should get an ear checkup because you hearing is very important because it's very well known through the Lancet study that hearing is one of the most common precursors of dementia if you don't take care of your hearing loss earlier. And third is teeth. I can give you the best diet on earth and you don't have teeth to chew. So that can be a problem. So these three things should be done yearly, and that will help you to keep your body in check. The reason I'm saying is quality of life. When you go to a geriatrician, that's what matters. I know to an extent I cannot cure all the diseases, but I know that I can care for you. And ultimately, quality of life and independence matters, taking into consideration your choices. I will not be paternalistic. I need to understand that what you have. And same is with caregivers. Caregivers are a part of the team. Goals of care are very important in older adults. And the more we are able to discuss, and these goals change. I mean, it's not that if 65-year-old and the same person is seeing me when he or she is 80, the goals will be same. Maybe it will be more comfort. Then shared decision making is something which we always do. Always, it's what is important in geriatrics is the narrative medicine. What does the person want? A lot of times we as doctors focus on what our goal with the person is. That's not the goal. The goal is what the person wants. And if we are able to discover that as a geriatrician, we are able to obviously solve the problems. Things can be very complicated in older adults, but they're very easy to break down. If you take care of every problem with importance, if a person comes with a pneumonia, that's most important for me. But that doesn't mean I forget the dementia. I take care of the dementia. I take care of them. I mean, staying alone. So it's a life course. Why you come to a geriatrician? You don't come for only the point. You come for a life course because ultimately we have to make sure you don't have things in the future. Like just to highlight before I end, falls cannot be treated. They have to be prevented. So a prevention of fall, even raising your toilet seat is important. Getting a house check whether you will fall at home. Always said home is the safest. Not really. Home is where people fall the most.
Right. You mentioned three very important things in your book. One is an eye checkup, one is a hearing checkup, and a dental checkup. Now, when should people actually start committing to an annual check for all of these things?
See, ideally, you should do almost everything in your 40s. The reason I'm saying is at least start checking. I won't say annual, annual can be more in the 50s. Because a lot of times we tend to, I mean, very simple. We get headaches, we tend to take the medicine for headache. We never check the vision. So, whereas it's just that people would have got spectacles. So, almost all I've seen investigations done, blah, blah, medicines taken, but the eye has not been checked. All you needed to do was just get a number. Then another thing which I would highlight, of course, apart from that, is a memory screening. So a memory screening should also be done at least 50 plus because you need to understand where you are. See, the important thing is the earlier you intervene, the better it is. I mean, it's a cliche. We don't say it. It's in movies only. "Aap pehle aate to better rehta." That's not something that doctors ever say. It is now that you do so that you don't get in future. So it's about now. So I feel 40s you should start with all, but after 50, definitely more frequently. And after 60, every year you should definitely do your eye, ear, teeth checkup, even memory screening. Worst come worst, they'll be normal. You will at least know that, or they might something we'll find and we will be able to help you. See, it's all about correcting the correctables till they are correctable. If you don't check, then all these things can get worse. And it might be in a situation where you are giving more power to the doctors. I always say the more discipline you show, the more dedication you show to your diseases, the lesser you meet me and the lesser you meet drugs.
And we've discussed memory screening earlier on Longevity Short, but if you could just tell our viewers, what does it entail? Because a lot of people are fearful of needles, scans, MRIs, etc.
So memory screening is nothing. It's just a questionnaire. It can be as small as for less than a minute to elaborate ones, which I would only do if I see some deficit. And if needed, only investigations are done. So we as geriatricians are always done investigations only when needed. But a lot of times basic health checkups are not done. Uh, so if needed, blood tests are done. And of course, if glaringly we find deficits, then of course an imaging will be done, whether it's a MRI brain or it's usually a PET, depending upon what deficits you have. Sometimes people have family history, and then so people want to know whether genetically they are sort of risk, especially young onset dementias. So then we do the genetic testing. It's slightly expensive, but we don't do it for all. So what I'm trying to highlight is it's not like one fit for all that you do everything for everybody.
Now, before we move on, I want to address one very important thing with NCDs, like say diabetes or heart disease or dementia. I mean, one, of course, is the fear of decline in health. The other is inevitable, which is death. And then but apart from all of that, how does it affect the quality of life when we are living?
Significantly affects because it's a cumulative deficit. Again, the more controlled the NCDs are, the more better the quality of life. The less control it is, the worse. Again, case in point, we'll have to die. I mean, I will have to highlight diabetes. If your control is horrible, you won't be able to feel. So your nerves are gone. So walking becomes a problem. Your increase of fall happens. People have diabetic ulcers. They don't even realize they have an ulcer because there is no sensation. Vision goes. Imagine not being able to see properly, everything blurred. Kidney goes. So imagine being on dialysis. So everything. So the almost 3 to 4 major organs are gone. And then you are more and more dependent. So definitely, if you don't control the diseases, the NCDs, they will only make it worse. And if you have more vascular risk factors, which are these NCDs, then you get a risk of dementia as well. There is a risk of stroke as well. So if you get and multiple insults throughout the life actually makes the organs more worse as compared to maybe a controlled disease, which actually sort of keeps you okay for a while, and only if something glaring happens. Then one has to understand, see, everything is not textbook. So somebody will get an infection suddenly. So once an infection comes, the body's equilibrium goes. Now, how the body bounces back is directly proportional to how fit you were before. I mean, how fit we were before illness. So there is a concept of frailty in older adults. So when you are frail, you cannot generalize that, oh, he's frail. I mean, it has to be documented that he's frail. If a frail person gets an illness, they might not come back to the baseline before the illness. Whereas if you're not frail, you will still be over time come back. So the thing about dependence is it's a balance. Everybody gets dependent for some time. You get an illness, you need support, but you bounce back. A person who is frail might not be able to bounce back. After the illness will get worse.
Right. So, apart from the impact on your lifestyle, I mean, obviously, it's impacting your lifestyle. It's impacting how you work or your ability to work. Let's talk about money for a minute. Now, I did come across research which estimated that over a lifetime, just for medication, diabetes medication, a person with diabetes would end up spending around 20 lakh rupees. But that is only the medicines for diabetes. Now, over and above that, like you said, it affects multiple organ systems in your body. There is care that you might need. There is a lot of testing that you need. So, ballpark, how much would we end up spending on an annual basis? Say somebody has diabetes with certain complications.
See, I mean, it's difficult to put in a figure purely because it all depends on what your financial backing is. By that, I mean, are you having any kind of government backing? So if your family is like in any kind of central government jobs or even in the army, ex-army men, so they are able to get medications.
No, no, I am talking about just plain bills. I mean, if I have to pay
I
a
mean,
certain
I mean,
amount,
there
how
is
much
no,
would
to
it?
be frank, there is no upper limit. It all depends upon how bad the organs are. And I mean, to put it only on diabetes will be difficult because nobody with diabetes only has diabetes.
Yeah.
They end up getting multiple comorbidities. I mean, it can go anywhere, and if you mix a hospitalization in between, then everything goes haywire. So, I mean, with the figure you're saying, you can add. I mean, you can double it. I mean, it can be anything more than that,
So it can be
for sure,
40, 60 lakh,
for
1
sure.
crore or 2 crore rupees, you're saying.
It
depending
all
on.
depends upon how the health is, and it depends upon whether there is an admission involved. If there is an admission, everything changes.
But
And
if I were to take care of my health in my 40s,
hmm,
and actually try to change the things that that we'll discuss now, then can I actually reduce my healthcare costs as I grow older?
you have one admission and the finances go out of the roof. So that's the reason why we always say that having insurance is very important. But at the same time, if you want to reduce your health costs, the fitter you are, the health costs are obviously going to automatically reduce. But at the same time, have a insurance. So another way, of course, I should add into this is that immunization helps. I mean, you have to get immunized. It's and it's not even pun intended. You get a shot in your arm, you are much, much fitter, whether it's for pneumonia, whether it's for zoster, whether it's for influenza. COVID made people think about vaccination again. I don't want to go into the controversies because ultimately only the controversies were highlighted. But yeah, but majority of the people were vaccinated and people started asking about vaccinations more after COVID. Whereas before it was more us telling them, please take your vaccinations on time.
In fact, I'm glad you brought this up because in this part of the interview, I would like to actually focus a little bit on prevention and the things that we should start doing in our 40s. Uh, and I'll come back to vaccination in a bit. But first, explain why is 40 so critical? Because uh, it's not just you. A lot of experts who have come on Longevity Short have told us that, start doing these things in your 40s. Why the 40s?
The reason is, see, people are very fit at 60 also, but people plan that. You can plan how you age these days. You can actually, I mean, whether it's exercise, whether it's cutting down on stuff which you thought you could actually take earlier. So, what is important uh, is that in this particular decade, if you have to say 40 to 50, is where you can mold. There are still things you can change. But as you get into 50, the body obviously it's more difficult. I wouldn't say it's never too late. I have had people who have got much fitter much later, but they have to be very determined. In 40, your body can still support you with that determination. In 15, 16, 70, it will be pure determination, and your body might not be able to support you that much. And it's a very simple. I mean, prevention is better than cure. Earlier, the better is always true. It's not a cliche. I mean, the earlier you control your health, the later you will not have to sort of give away control. I say a very simple thing, which I am repeating maybe. I am saying till it is in your hand, it is good. Till it goes out of your hand, then it becomes very, very difficult. And then once you're dependent on drugs, you're dependent on doctors, your lifestyle, your quality of life, and independence becomes very, very difficult. So I think that inner determination, the inner will, can be very strong between 40 to 50 because you're putting your energies into a lot of things. And it might be a good time to annex that and take things under control, even if they have not been under control. Because earlier, the body was good in metabolism. Even if you're not trying to take control, the body was handling it. But now the body will slowly and steadily telling you it's time that you take control, or else once other things take control of your body, then I will not be able to help.
Right. So, like you mentioned in the 40s, what are the how do we take that control? What are the habits that you would like people to change, in their 40s?
I think one of the most important, we have uttered so many times, is the way you live, that is the lifestyle. I mean, usually a lot of times people concentrate only on diet. That's not how it is. People eat everything, but they metabolize it. And that you do by exercise. So it has to be diet plus exercise. It cannot be only diet wherein you're stopping everything and you're weak most of the time. You are just starving yourself. That is not always going to help. Now, amount of water you take, we always tend to forget. Fluids are very important. One of the most common causes of headache in summers is actually dehydration because you have not taken water. And you will be ready to take a paracetamol, but you will not be ready to take water. So that is the difference. and you have to keep reminding yourself that you have to drink water. So it's like 2.5, 3, 4 liters until unless you have a heart disease, kidney disease, or a liver disease, there is no restriction. As you go older, there will be restrictions as well. Then I think sleep is very important. With the advent of technology, it has only got more worse. I mean, people tend to see their blue screen when they're sleepy to think it will put them to sleep. But that's not the case. It actually sort of delays the melatonin surge, and then you're obviously killing your sleep. Then to get back into sleep is very, very difficult. Then in the era of technology, use devices. Technology is only going to help you. I mean, there are such good rings, there are watches, there are things which will help you understand your body better. Fine, they have different levels of accuracy, but at least tell you. So, for example, I use a ring. So, in the morning, the day I'm not, maybe for whatever reason I've had a late night, it tells me that energy is low. And it's not that I see that and I feel low. When I'm seeing the energy is low, then I see that, and that's also telling me the energy is actually low. So use that as a guide to motivate you. Or not that, "Arey yaar, wapas, now it's telling me to stand, it's telling me." That's what you cannot react to it that way. That's supposed to be supportive to you. So use technology to give your reminders, exercise your brain. You keep talking about only physical exercise. You have to do activities. Social connections matter a lot. Meet people, irrespective of how you are. A lot of people are, this is what I am. I've always been a person who doesn't want to interact or sort, but you have to take that effort. Nobody bas or, I mean, nobody is doing well in isolation. I mean, nobody does well in loneliness. So that is also very, so this is when, I mean, the 40s is when you can still sort of make a lot of social connections, whether it's in your business, whether it's in your workplace, whether it's friends, family. Get in touch with your friends. It doesn't matter with friends. And every day, I think every year, whether you're old or young, it's important to get up with a purpose in the morning. It can be very small. It can be just today, I want to see the sunrise and I want to feel good about it. Then another thing you have to do from sunrise, I remember, go into more of hinterlands, go into, I mean, silence, hear the birds chirping. Those things are something which we don't do at all. Good environments are still there. It's not that you have to hear the honking only every day. You need to go there. Digital detox, according to me, is also very important.
Uh,
Mhm.
Most of us think that vaccines end in our, once we grow up, once we get out of school. What are adult vaccines that we should be taking?
But in general, for adults, I would always say that, I mean, pneumonia is one of the most common killers in older adults, and it causes a lot of mortality, morbidity both. So that is one. In which uh, that is something if you take, then you have a protection at least for 5 to 10 years. Then flu shot has to be taken every year because the season changes and the flu thing vaccine only works for a year. And one of the very important things is the zoster vaccine. I do understand people say it's expensive, but if you get zoster, it is bad. I mean, the pain that people get is absolutely, it's impossible to bear. I have had people who have had pain for 5 to 6 years post having herpes and finally only okay with nerve blocks. So you are saying basically invasive procedure. So we always say try to help in prevention more rather than going for cure. So so zoster is something which is has to be given, sort of 2 doses have to be given, but it is safe. I mean, it is something
What
which
what
I
age
was.
what age should we be taking the zoster vaccine?
See, you can start, according to me, you can start 50 plus. And 60 plus, definitely you should take. Now, as far as pneumonia vaccine and influenza as vaccine, sometimes when you are younger, but you have diseases like COPD, you have had a history of TB where your lung is already damaged, you have bronchial asthma. So, all those things make you vulnerable. So, you should be taking it a bit more earlier as compared to maybe
I mean,
later.
we all are living in very polluted environments right now, and we also travel to work. So would you say people in their 30s and 40s should also start from
40s
taking?
can start, according to me, start taking. There is nothing wrong in taking a flu shot for sure. Of course, particularly, it completely changes with healthcare workers because then that you have to end up taking different vaccines because your place of work itself becomes sort of a risk. Then, of course, there is always a lot of older adults have asked me about traveling also. So it depends on where you are traveling. So whether it's the Africas, then you have to have that yellow fever, encephalitis vaccine. So all those things. So there is specific. So another thing, I mean, the reason I'm highlighting is this because it's a part of prevention, and more older adults want to travel if they are fit. So make sure that you get the knowledge of which vaccinations you might have to take. Number one. Number two, which vaccinations are mandatory to take? Because there are certain countries which expect you to take the vaccinations also. Especially we come from a country where malaria and dengue and everything is quite common. There are countries where it's not very common, so they are more fearful that if we are coming as well. So I mean, so you should know. So have the basic thing about vaccination, I would say, is gain knowledge about it. Ask your doctor. Don't just Google or AI it or chat GPTs. Ask your doctor questions. Take an informed decision of taking it. That's what I do. I tell them the pros and cons. I tell them if there could be any side effects. And then that is when I give it. Because ultimately, that's how you motivate people to take vaccinations. You cannot say, no, you have to take.
What about mental health? Now, 40s is also typically when stress increases for a lot of reasons. It could be the responsibilities you have at work. It could be care. You are sandwiched between two generations. And you're caring for both of them. So there are a lot of things on your plate. So stress obviously peaks. How important is mental health to aging healthy? And what do we need to do in our 40s to start, sort of taking care of ourselves?
See, I think mental health is always something which has been neglected. But things like stress can sort of get you into depression or get you into anxiety. But you have to take it seriously because if it's happening very frequently and it's affecting your day to day life, it's affecting your quality of life, then you need to address it. And solution is not always drugs, it is drugs along with talking, along with counseling. See, the most important part in mental health is that you are given the confidence to do better by taking help. Ultimately you will make the change, but don't keep delaying going to a person who might help you to make that change. That is something which happens, inertia in knowing. They say no, jo dikhta nahi wo bikta nahi hai. So it's mental health, you can't see, right? But you get a chest pain, you'll be the first person to go
No,
to the
but why
emergency.
like you just
So that's why motivate yourself to go to the mental health specialist. But the discipline of following what they say is what is going to get you out of the mental health hole. And it is treatable. It is not something which is not treatable. I think that's the most important part. If you're missing out on something which you can treat, then it's a travesty because a depression in the initial phase and late phase is very difficult. It might be at a time where you are not even wanting to go to the doctor, you don't want to get out of the home. So red flags have to be seen by friends, red flags have to be seen by family. A person who's totally active, suddenly getting disconnected, not wanting to talk, there is something wrong. The most common cause of any mental health illness is physical illness. A person who has got some physical issue, for example, not able to walk, totally independent but had a fall, older adults happens very commonly. Sense of self goes. Retirement age, very, very important. According to me, retirement is a myth. Don't get retired only. Retirement is usually from a phase of life. You don't retire from a job. You retire from that phase and you can do anything that you want afterwards. In fact, retirement is a ticket for you to do anything. So plan your retirement. You're highlighting mental health. That's why I'm telling. If you don't plan your retirement, mental health can go very bad. Suddenly you don't know what to do. So the last 1 year before retirement, you should plan what you have to do. You can keep thinking, oh, I'll go to my daughter, I'll go to my son, I'll spend my time. No, that's not how you plan it. You plan it on what you exactly want to do, because you might think your friends will give you time, but the friends might be busy, right? They
right.
might have their schedules. So plan. Everything is planned. So plan your retirement. That's how you plan your mental health. And give time for mental health. It will take time to recover. Be patient. Don't look for quick results. It's very easy to read something on WhatsApp and do it. But it is very difficult to be disciplined to be motivated to get your mental health better.
Now, most of us in our 40s at least, we start doing, those annual checkups and etc. But apart from that, this is also a time when your body starts giving you some signals. Something starts paining, something starts hurting, you're not able to do something, or you try to run or something at your child's sports day and you're not able to, you know, uh, do that without panting. Now, what are these signals that should worry us? What are the red flags, like you said, that we should
See
look for?
now, there are plenty of red flags in the sense that you getting up tired every day and still you are pushing for work. You're not very happy. Your sort of concentration is going. You're forgetting things in that way that you are a very organized person, but you're just forgetting that these things have to be done. Your performance is going down. Then you are actually trying to shun away taking responsibility. So these are all sort of red flags. But you are working in hours, but you're not working in result. So, and then that keeps adding. So 1 day sleep not okay is okay. 10 days sleep not okay is not good because the deficit keeps adding, 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 adding. Now, one of the most important thing, whatever you say in their work will always be there. I think self discipline and taking care of yourself is most important. Another red flag is suddenly not trying, wanting to meet people at all, always being irritable. I mean, taking only the negative things in life, only being restless, uh, then overeating. I mean, overeating, one of the most common signs of actually depression is also overeating because we tend to fill up our depression by eating. Then tending to, of course, a tendency obviously to, I mean, you might just not be taking very less alcohol, but tendency to take it even more as an escapist route because that makes you forget things. Technically, it doesn't. It just makes you delusional for that particular period. And next day, you get up with a headache and your problems remain. So, so not being able to focus at work is one thing, but not being able to get up in the morning and wanting to do anything is another thing. So these are all sort of red flags. You have to listen to your body. You are able to exercise now, but you are not, even exercise is not helping. Earlier, you used to listen to music that used to cheer up. That is not working. So everything that you do, if it's not working, means it's an absolute red flag. You
So
need to
those
start
are
taking help.
obviously, these are the red flags that you highlighted for your mental health. For your physical health, the one reason why people generally rush to the hospital is because their chest is hurting. What are the other red flags physically that your body is giving you in your 40s?
Then, yeah, I mean, for example, if you were able to take the stairs earlier and now you're having breathlessness, that is also a sort of a red flag. You were able to walk on a straight line properly for more than 1 kilometer, 2 kilometers. Now you are sort of getting breathless. So that's another physical sign. Neglecting, you keep saying gas, and neglecting continuous chest pains, which you are attributing to some masaledar thing that you took. That is also actually a red flag in your 40s because, and the biggest red flag, according to me, is not doing a health checkup. I mean, that is the biggest red flag because you are fearing that you will discover something, but you are in denial that छोड़ो यार अभी करेंगे तो कुछ आ जाएगा. So you need to. According to me, that's one of the biggest red flags, which is easily missed because nobody keeps a tab, no, that you are. Now, I have seen workplaces which are getting better. They have motivation people for actually doing health checkups. So there is a promotion or there is a result attached to it. Or if you keep your health good, if you lose so much weight, if you become more healthier, then you will be given more gravitas. That's a good way of doing it in the workplace because that motivates people to work on their health and to work also. Then weight gain, one of the biggest flags. I mean, suddenly just gaining weight out of no reason, you have been eating well. Weight loss, sudden weight loss. That is also one of the biggest red flags of physical health. Not able to eat. Then hair loss is also, to a great extent, also an indicator of your body telling that something is not okay. Getting frequent ulcers. Not that you are taking oily stuff, but getting frequent ulcers. So all these things are very much a pertinent of physical health. This is when your body is starting to start doing something about it, or else things will get worse.
You mentioned memory screening. Uh, so, what are the red flags as far as conditions like Alzheimer's and dementia are concerned?
See, forgetfulness is one of the most common, but people won't forget your long memory. So that long lifetime memory, past memory is not going to go. what will be the red flag is the short term memory loss, forgetting things on a daily basis, forgetting what a person ate for the last meal, forgetting, keeping things here and there and not able to retrace,
We
wandering.
often lose our keys. We often lose car keys, home
Yeah,
keys.
but we are
We
able to retrace
misplace.
it.
Right.
But we are able to retrace it and find. People who are forgetting won't. They will not even remember that they misplaced the keys. And that becomes difficult because a person with dementia, actually, there has been a lot of times where discovery has happened when they have lost money, but they have no way to know where they have kept. So retracing is absolutely zero. Then personality changes. Personality changes also can be indicator. Language changes. A person who is understanding earlier now is not able to understand. Then direction is very important because see, Google Maps has been used latest because of technology. People earlier used to know directions in and out, but starting to forget that. Then something known as visuospatial, not understanding that, okay, you're able to see, but you're not understanding, connecting where you are. So those problems also. So see, the most commonly seen is forgetfulness, but that is not the only symptom that the older adult with dementia and Alzheimer's will present. So these are usually the plethora of symptoms. Sometimes they come late when they are more dependent. They are absolutely bedridden, but that is much in the later stage.
If I were to ask you to give us an action plan, what would you have us do at age 40 so that we, set ourselves up to age healthy?
So the action plan has to be basically a goal which has to have an action. I mean, goals we all make, but we don't actually take an action on it. And sometimes the action won't happen on day one, but you have to keep pushing yourself. So diet, I think, is very, very important. It's not what you eat that matters, it's when you eat that matters as well. For example, you have the most heaviest dinners, that's not going to help you. Lunch should be good according to me. Breakfast, people always said breakfast should be the best, but not always necessary. Lunch is when the metabolism actually will be the most because you're working. Remember, you're working, you're actually very active, and the tendency to get tired is also more because you have worked half of the day. Breakfast should be good because you can't be on zero. It's like you are on in the car, you have no fuel, and then you try to work. Your body will obviously break down. Good sleep is very, very important. That's a non-negotiable according to me.
When you eat is also important. So, what time should you ideally be having dinner? I mean, some say 5, some
See,
say 6, some say 7.
I feel anything below before 8 is good enough. Ideally, they say that before you sleep, you should all at least give 2 hours of digestion. So 2 hours before your sleep, you should. People, lot of people have a lot of erratic timings. It doesn't help. Remember, the metabolism is at the worst in your sleep. It's going on, but it is very slow. Whereas earlier in the day, it is actually much better. And when you're exercising, you're tending to burn more things in the morning as well. So then getting on to the next point, of course, was sleep. What is important with sleep also is environment. We keep talking about sleep as if it's like some kind of magical thing. It's not, it's a very normal thing, but it has factors of environment. You can't sleep with the music blaring. You can't sleep with you can't sleep with construction actually happening. Uh, then you cannot also sleep with maybe you drinking a nice Coke, which is sort of a diuretic kind of thing at 10 o'clock in the night. Fluids, especially tea, coffee, cold drinks, a strict no just before sleep because that is going to cause you to get up. Uh, then I think exercising is very important. Know your body and decide the exercise. Just because he or she is gymming doesn't mean you have to gym. Maybe you should play a sport. It depends on how you have to understand your body. You cannot just say just because X is doing, you will also do it. Just because everybody is playing pickleball today, you will also play. No, your body has to be that type. You have to be able to do it. Uh, then work on your body first before you start a sport. Always warm up before you do anything. You can't just get into it and the next day is full pain and then the third day you leave everything. Always give yourself graded increase. Start slowly, slowly and steadily, then increase your.
Okay, one more thing with regard to exercise: how important is strength training as you grow older?
Very
Balance
important.
training as well.
All are important. Strengthening, balance, and resistance, all are. But when it is to be given is important. That's why we say that you should not start everything on yourself. If you have a balance problem, you have to focus on the balance problem, simultaneously work on strengthening. A lot of people start assistive devices on their own. That's not just because somebody else's stick doesn't mean it is going to work for you. So those things are very, very important according to me. So all are needed, but it depends on what is needed when. Yeah. And
Exercise, sleep.
just to add
Yeah.
on the habits part, the alcohol and smoking is not healthy. Any amount. Smoke. So if you stop it or you're not doing it, it's better because technically you are abusing your body. I mean, how? There is no doubt about it. There is nothing known as a safe alcohol or a safe smoke. So the lesser you do it or you don't do it, the better your body will be. So that is also one of the habits. And drinking good amount of water. I mean, that is very, very important. You cannot dehydrate your body continuously throughout your life to an extent where you will not be able to take fluids because your heart or your kidney or liver would have got worse.
Right. So if I had to, I mean, there are a lot of things that you said. So if I had to pick up just one thing to, focus on, what should I do? One non-negotiable thing.
I think in health, a non-negotiable single is not right because health is multifactorial according to me. But I would still say that, according to me, one of the very easiest things to do, which we don't do, is sleep. That's very much under our control. We tend to delay it through various factors. So, sleep is something which is non negotiable purely because it has added accumulation and it can affect whatever I have said. And it's a cause and effect. Because you drank alcohol, you might not sleep, or because you're not sleeping, you might drink alcohol. So, same is with smoking, same is with eating. If you don't get sleep, sometimes people just get up and eat. So the fact of the matter is you have to make sure that you sleep well so that you actually have that refreshed life so that you can do all the other things that I did. Because if you don't sleep well, you're going to be very tired. You will not do anything else.
And that, I must say, is a great place to wind up our conversation. Sleep, as we like to say on the Longevity Short, is the laziest hack that you and I have to age healthy and live healthier longer. But now it also does seem like sleep is a smart and sneaky hack as well, because, like the doctor just pointed out to us, in order to fix your sleep, you have to fix a whole lot of other things. In fact, almost everything else. So, sleep in that sense is a great place to start your health journey. Dr. Narasimhan, thank you very much for joining us on the Longevity Short, and that was a very, very insightful conversation. So, thank you. Now, if you found this interview useful, I've queued up one more conversation that you might want to watch. Now, the doctor did mention that there is nothing called retirement and that you need to plan for that phase of life. In fact, this conversation that I've queued up for you addresses exactly that. Especially if you're in your 40s like I am, this expert will tell you why we cannot afford to retire financially, mentally, or physically. And he also tells us how to plan for it. And like your health, you need to plan for this as well in your 40s. So do watch it. And if you like India focused longevity content like this, make sure that you subscribe to the Never Too Late channel so that you are informed whenever a longevity short drops. I will see you soon with another conversation. Thank you for watching.